Welcome, and thank you for watching this video tutorial on the domestic medical screening. Over the next few minutes, this video will give a brief overview of the domestic medical screening, offer guidance on how to set up an appointment for the screening, and give a few recommendations for preparing for the appointment. What is the domestic medical screening? The domestic medical screening is a comprehensive medical examination that promotes the health and well-being for the following individuals: refugees, asylees, humanitarian parolees who are members of groups that U.S. Congress has deemed eligible for refugee benefits. Currently, that is Ukrainian, Afghan, Cuban, and Haitian humanitarian parolees, special immigrant visa holders, or SIVs, certified victims of human trafficking, Cuban and Haitian entrants, and Amerasians. Please note, refugees and other eligible newcomers do not have to pay for the domestic medical screening. Depending on the state, the Refugee Medical Assistance Program, or RMA, Medicaid, or the Children's Health Insurance Program, also known as CHIP, cover medical costs. Typically, domestic medical screenings are conducted through a health clinic or provider designated for having expertise in refugee populations, overseas medical screening processes, and refugee health recommendations. The screening is always conducted by a licensed medical provider. The medical screening can take up to 3 clinical visits to a healthcare provider and includes a review of your overseas medical screening and personal health history, a physical examination, testing and treatment, and immunizations you may need. Please note, refugees and other eligible newcomers should complete the domestic medical screening within 30 days of arrival in the United States, or from the date of eligibility for ORR benefits and services. Try to schedule the domestic medical screening as soon as possible, as in some cases there may be a wait list. A delay in getting up to date with immunizations could delay school enrollment for children. In general, timely access to the domestic medical screening helps you get connected to healthcare and maintain ongoing care. The domestic medical screening is not attached to an individual's change in immigration status. Often a newcomer's first touch point with the U.S. healthcare system, the domestic medical screening is meant to promote the health and well-being of refugees and other newcomers so they can resettle successfully in their new country. The domestic medical screening is not the same thing as the adjustment of status exam, which is required when individuals apply for their green card or permanent residency status. It is important not to confuse this exam with the domestic medical screening, especially when scheduling an appointment, as the adjustment of status exam can be costly. The domestic medical screening may be called by a different name depending on the state you are in. For example, some states may refer to it as a refugee health assessment. To learn more about the domestic medical screening, visit www.acf.hhs.gov/ORR/programs/refugees/medical-screening. The process for scheduling an appointment varies by state. First, find out how to schedule an appointment in your state. Here are some ways to find out. Go to the state-by-state resource map on the RWC website for state-specific information. Visit www.refugeewelcome.org/state-resources. Here are some other ways to find out how to schedule the screening in your state. Many states have websites hosted by the State Health Department or Department of Health and Human Services with information about the domestic medical screening. Visit their websites for information. For a state directory of health departments, visit www.cdc.gov/publichealthgateway/health directories/healthdepartments.html. Most states have a state refugee health coordinator who is responsible for ensuring refugees and other ORR-eligible individuals have access to the domestic medical screening. Contact your state's refugee health coordinator by visiting this website, www.acf.hhs.gov/ORR/grant-funding/key-state-contacts. If you are part of a private sponsor group in Welcome Corps, you can discuss the process with your private sponsor organization, or PSO. If you are working with a resettlement agency, either as a newcomer or sponsor, you can discuss the process with a case manager. They may schedule the screening or provide more information about how to schedule it. Before the appointment, you should locate your records from your overseas medical exam, if applicable, and any other medical records you may have. and bring them with you to the domestic medical screening appointment. Doctors who conduct overseas medical screenings also upload this information into the Migrant Management and Operational Systems application, also known as MIMOSA. They do this prior to refugees' arrival into the United States, so it can be shared with the Electronic Disease Notification System of the Center for Disease Control. Be sure to bring your medical folder from your International Organization for Migration, or IOM, bag to the appointment just in case the doctor is unable to retrieve the information from the system. Bring a form of personal identification. When scheduling an appointment, ask what you should bring to the screening if instructions have not been given. Please note, arrive at the appointment on time or early. Arriving late for the appointment could result in the appointment being canceled and rescheduled for another time. If you are part of a private sponsor group, here are some key considerations when supporting newcomers with the domestic medical screening. Support the refugee newcomer with scheduling an appointment for a domestic medical screening. Please note that private sponsor groups are responsible for supporting the refugee newcomer in completing the screening. Prepare the refugee newcomer for the appointment. Keep in mind that the domestic medical screening will most likely be a refugee newcomer's first experience at a healthcare center in the U.S. This appointment can be an important opportunity to explain the process ahead of time, to lessen any anxiety or fears they may have about the screening. Also, before the appointment, take time to discuss the importance of patient privacy laws in the U.S. Newcomers should feel comfortable speaking to their doctor about any physical or mental health concerns they may have, without fear of being judged or of their private medical information being shared with others. Discuss cultural considerations related to healthcare in the U.S. Take the opportunity to orient the refugee newcomer to healthcare in the United States. For example, some cultural considerations to share may include the U.S. does not have universal health care, and refugee medical assistance, also known as RMA, differs state by state. In many cases, RMA is available for 8 months. Another cultural consideration to share is that preventative health care plays a large role in reducing risk of disease and maintaining good health. And another cultural consideration is that there are norms associated with healthcare services in the U.S. For example, it is important to be on time, and medical information that is shared with a health provider is kept confidential. For more information that addresses key messages on health for newcomers, visit the website of the Cultural Orientation Resource Exchange at coresourceexchange.org. Request an interpreter if needed or requested. It is important to request an interpreter while making the medical screening appointment if needed or requested. Never rely on a family member, especially children, or untrained community members to interpret. The healthcare facility is responsible for providing the interpreter. Be attentive to preferences for a healthcare provider. Newcomers may prefer to work with a healthcare professional of their own gender. This may include interpreters, medical assistants, and nurses. If the newcomer prefers, try scheduling appointments with healthcare professionals the same gender as the newcomer. Be prepared to provide transportation to the appointment. If providing transportation, make sure to arrive at the newcomer's home early to allow for plenty of time to get ready and to make it to the appointment. Arrive with appropriate car seats if necessary. Be prepared to assist with check-in and pick-up after the appointment. Upon arriving at the healthcare facility, make sure to park and walk the newcomers in. Assist with getting them checked in and verify that the interpreter is there. Assist without doing everything for the newcomer. Allow them to check themselves in and remain close by to assist when needed. You can request that the facility call you when they are finished if you are not able to wait, or make sure the family has your phone number. Make sure to decide on a place to meet, for example, outside by the door, for pickup. You can also take time to practice how to check in before the appointment date and on your way to the appointment. Do not invite yourself into the exam room. No member of the private sponsor group should be present during any medical visits, as patients have a right to privacy. If there is an urgent medical need, do not wait for the domestic medical screening. Assist with accessing appropriate medical care. It is not necessary to wait for the domestic medical screening if newcomers have an urgent medical need requiring professional medical attention. To address urgent needs prior to a medical screening, sponsors can assist newcomers with accessing appropriate primary care providers or specialists who accept Medicaid or provide services free of charge or on a sliding scale. Many hospitals offer charity care or negotiable rates for individuals who cannot afford care. Also, contact your state refugee health coordinator, as they may be able to assist with referrals to a trained network of clinics to address urgent medical needs. Medical emergencies can be addressed by an urgent care or hospital emergency department as appropriate. In an emergency, call 911. Provide support after the appointment. Ask the newcomer if they would like assistance with scheduling any follow-up appointments, or inquire if there is a clinic social worker or care coordinator who can help them navigate their care and provide extra support. You should work with the refugee newcomer and the healthcare provider to make sure that all communication is happening directly with the refugee. Remember, the goal is to promote the newcomer's independence in navigating the healthcare system. For newcomers, here are a few final takeaways. The domestic medical screening promotes your health and well-being for a successful resettlement in the U.S. You should complete the domestic medical screening within 30 days of arrival, or from the date of eligibility of Office of Refugee Resettlement Benefits. You do not have to pay for the domestic medical screening. Prioritize your health and well-being. Starting a new life in the U.S. involves opportunities and challenges, like learning a new language, adjusting to a new culture, finding a job, or going to a new school. Addressing your health needs and having access to regular medical care are important to a successful resettlement. Visit refugeewelcome.org for more community sponsorship resources.